Hi, everyone. Thanks for joining us. We're going to allow some of the participants to keep rolling in, and we'll get started in just a few minutes. Hi, my name is Nadine, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Services for Students with Disabilities, IEPs and 504 Plans. During today's presentation, we will learn about the different supports available within schools for students with physical and mental disabilities and chronic medical conditions. But before we begin, we have a few housekeeping reminders. First, please help us with our attendance count. If you are viewing as a group, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the Q&A icon located in your Zoom toolbar. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archive webinars for topics such as the ones you are viewing on your screen. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based health care. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick expert attention, and we all know that healthy students make better learners. Now, I would like to introduce our presenters today. Caitlin Schock is the specialist for Section 504 and student accommodations for the District of Columbia Public Schools. Caitlin leads DCPS's work supporting students with 504 plans, developing policies, and facilitating the creation and implementation of 504 plans for students across the district. During her 2-year tenure, Caitlin has increased the number of students receiving accommodations, expanded the supports available for school-based 504 coordinators, and crafted the district's policy for implementing Section 504. Prior to joining the Section 504 and student accommodations team, Caitlin supported the DCPS Office of Specialized Instruction and the DCPS Office of Innovation Research. She has also participated in a visiting fellowship with Education Pioneers. An alumna of the Catholic University of America with a bachelor's in English, Caitlin also holds a Master's of Arts in Education Policy with a specialization in K-12 education policy from Teachers College, Columbia University. Diana Bruce is the Director of Health and Wellness for the District of Columbia Public Schools. Diana has more than 20 years experience in child and adolescent health, reproductive health, HIV, STI prevention, and sexuality education. As Director of Health and Wellness, Diana leads DCPS's School Health Office, developing policies, programs, systems, and partnerships that enable local schools to provide school health services and supports for students. During her 8-year tenure, Diana has expanded school-based supports for expectant and parenting students, brought to scale the school-based STI screening program in all high schools, supported the expansion of school-based health centers from 2 to 8 schools, initiated the development and implementation of DCPS's programming to make its schools welcoming and inclusive of lesbian, gay, bisexual, transgender, and questioning students, staff, and families, and led the revision of DCPS's local wellness policy. Prior to joining DCPS, Diana was the Director of Policy and Government Affairs of AIDS Alliance for Children, Youth, and Families in Washington, D.C., and served temporarily as Interim Co-Executive Director. Diana's other past experience includes working as the Senior Policy Analyst for the National Family Planning and Reproductive Health Association and Assistant Director of Clinical Services for Planned Parenthood of New York City. An alumna of the University of Texas at El Paso with a bachelor's in journalism, Diana also holds a master's in public administration from Columbia University's School of International and Public Affairs. Diana serves on the Women's Information Network Advisory Council. Thank you, everyone. I will now turn it over to our presenters.
Hi, good afternoon, everybody. My name is Diana Bruce, and as was said, I'm the Director of Health and Wellness here at DC Public Schools in Washington, DC. DCPS is the largest school district in DC. We have nearly 50,000 students, and we're super excited today to share with you some of our best practices and protocols for serving the needs of our students with disabilities. We can go to the introduction. I think that we sort of covered that, so why don't we skip on to the agenda. Today we're going to discuss why a school-based health center should concern themselves with IEPs, individualized educational plans, and 504 plans. We're going to talk a little bit about what an IEP is, and then we're going to talk about 504 plans and explain what they are. Next, we're going to talk about how Medicaid relates to both IEPs and 504 plans, and that's really where a lot of the school-based health centers that are billing for Medicaid, where they have a role and where it's helpful and will be important for them to understand the roles and also the limitations that school staff have in billing. And then we'll share with you some additional resources that we've gathered along the way. So first off, why should a school-based health center concern themselves with IEPs and 504 plans? A couple years ago when I was at the School-Based Health Alliance conference, I heard over and over again in sessions workshops where folks were bringing all these really important strategies and interventions to schools and discussing ways of managing diabetes, asthma, all sorts of health conditions. And when I would ask sort of, and how does that work into the student's 504 plan, there was seemed to have been sort of a disconnect, but perhaps there's a lot of work that we can do sort of to bridge that gap of, and do some knowledge sharing from the school-based health center out into the school, and then also from the school back into the school-based health center. And so we really think that the school-based health centers who are providing and developing treatment plans for students have a role outside of their health center when it comes to setting up plans for accommodations with students that may be the responsibility of the school staff. So school-based health centers, fundamentally, they manage students' health needs, which are often addressed in either an individualized education plan, which is also known, folks may know this as special education services, and also 504 plans, which Caitlin will describe later as a different level of accommodations when that students may need to be successful at school. It's also an opportunity for collaboration, as I was describing earlier, to avoid the risk of siloing. It's so often there may be the social workers, the school social workers doing work over here, the 504 coordinators doing work over here. We've got the school-based health center doing work over here. Maybe the school nurse is doing another kind of intervention. And really, if we can bring folks together by sharing with you what we know about how school districts are developing and implementing specific plans and accommodations for students, then you are better prepared to reach out to the school staff in the health centers that you work in and engage and collaborate. It's also an opportunity to document and codify the needs that the school-based health center identifies. So, you all are the health experts, and sometimes you might be the only health professionals in a school building. And this really is an opportunity what Caitlin's going to describe in sort of helping you understand better how an IEP and a 504 plan might be prepared for a student. This is an opportunity for you to then jump in to either one of those processes and make sure that what you have identified as a best practice intervention to manage a student's healthcare during the school day is then incorporated into that plan, so it's seamless and that those important interventions are codified into a plan that's legally binding. Sometimes, as we know, legally binding things can sometimes be implemented with fidelity more, better than perhaps some other things. So now I would love to turn it over to Caitlin, who's going to take it away with the next couple items on our agenda.
Great, thanks, Deanna. So the first thing we're going to talk about briefly is what is an IEP. So we're going to talk about what is special education. So special education comes from the federal education law called the Individuals with Disabilities Education Act, which was most recently passed in 2004. And special education is specifically designed instruction and related services required to meet the unique needs of a child with a disability. And the key point here is that we are actually changing the instruction and the curriculum to meet the needs that students have. So in order for a student to be eligible to receive services under this law and to have special education, their disability needs to fall under one of these three very specific disability categories that you see on the screen now. And then if they have a disability that falls into one of those categories, then the school starts the special education process. So this starts with a referral. Then the school team comes together and does the evaluation and determines whether or not the student is eligible. They look at, does the student have that disability, and is there an academic impact that disability is causing? If the student's eligible, then the team at the school develops the actual IEP, the Individualized Education Program. And then finally, that IEP is implemented, and there is monitoring that goes into making sure that those services are provided to the student with fidelity. So the document that comes out of all of this is the Individualized Education Program that you all have probably heard of, referred to just simply as the IEP. And this outlines the amount of time that the student will spend receiving special education services, because we know in some cases the student might be in a special education classroom full-time. In other cases it might be that they go to that room for a few hours a day. For some cases it might be that an extra adult support comes into the room and works with them. The student might also receive related services on the IEP and some academic and behavioral expectations. So there are also goals that are written into the IEP. We're going to go a bit more in depth now into what a 504 plan is so that you can see the difference between these two types of plans. And I think in fact you'll see that the 504 plan actually probably overlaps with your work as a school-based health center even more frequently than students with IEPs do. So what we call 504 plans are named that because it is from Section 504 of the Rehabilitation Act of 1973. And this is a federal civil rights mandate that was created to prevent discrimination against individuals with disabilities in any program or activity that receives federal funds. So as public schools, we obviously do receive funding from the federal government, so this does apply to us. And it protects students with disabilities so that they are able to access the existing curriculum and any other educational opportunities that are provided by our public schools. So you'll notice when we were talking about special ed, we talked about modifying and changing the curriculum. Here we're talking about giving students access to the existing curriculum. So to be very clear, this is not special education. They are two separate programs, and in fact, students should not have an IEP and a 504 plan at the same time. And the 504 plan will allow the student to, through providing accommodations and related services, will allow the students to access the general education curriculum as well as any other opportunities for learning and any other school activities to the same extent as their non-disabled peers. So this means in addition to the learning that goes on in the classroom, any clubs or extracurricular activities, we also are making sure that students have access to those. So the law, this is what the law literally states. It says, no otherwise qualified individual with a disability in the United States shall solely by reason of his or her disability be excluded from the participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. So we're going to unpack this a little bit. So we're going to start with, what do we mean by qualified individuals? So a qualified person with a disability in the educational setting is anyone that is enrolled in the school. So anyone that is of an age that we are providing education to meets this part of being a qualified individual. So this means that we serve students from the 3-year-olds in our pre-K3 classes all the way up to the adults that are in our adult education programs. The next piece of this is, what does it mean to be an individual with a disability under Section 504? So you'll remember for special education, there was that 13 categories of disabilities that a student had to have. Section 504, you'll notice, is a lot more broad. A student is considered an individual with a disability if he or she has a physical or mental impairment that substantially limits one or more of their major life activities. So again, we're going to unpack this a little more, starting with the first part there, the physical or mental impairment. So a physical or mental impairment for 504 is basically anything that a medical provider or licensed mental health clinician could say that the student has. So some common examples of physical impairments that we see are students with mobility impairments, with hearing impairments, vision impairments. And really key for, I think, those in our school-based health centers is that we also serve students with chronic medical conditions. So any student that has diabetes, that has juvenile arthritis, has sickle cell, they could be served through a 504 plan. Additionally, we serve students with mental health impairments. So a lot of students with ADHD have 504 plans, also students that might have anxiety disorders or depression. So that's the first criteria for eligibility. The second criteria is whether or not that physical or mental impairment is substantially limiting one of their major life activities. So substantial limitation, I often hear folks note, is a little bit vague. So what we mean by substantial limitation is the extent to which the student is able to complete major life activities compared to the average student of the same age in the general population. So if a student is developmentally appropriate for, say, a 7-year-old, then there's probably not a substantial limitation on that life activity. But if we see a lot of difference between their ability to complete that compared to the average student, then we're probably going to see a substantial limitation. The other key point about Section 504 is that it is to serve students with disabilities, not those students with temporary injuries. The general guideline that we give in DCPS is if the condition is going to resolve itself in 6 months or less, it's probably an injury, not a disability. But this is certainly something that is considered on a case-by-case basis. But the big takeaway here is if a student has just a broken arm from falling off their bike in the spring, that's going to be healed up and fine in a couple weeks. That's an injury, so as much as we encourage our schools to make whatever accommodations are needed in the meantime, students with injuries do not need the support of a federal civil rights law to make sure that their rights are protected. So that was our second criteria. So first we talked about the physical or mental impairment. Now we talked about substantial limitation. Now we're going to look into the third criteria for eligibility, which is the major life activity. So a major life activity is basically anything that the student could possibly need to do throughout the school day during school activities. So we actually have a list of the major life activities that we commonly consider, which you'll see here. So we're talking about things like, is a student able to bend, breathe, care for oneself, concentrate, communicate, eat, hear, learn, lift. The operation of a major bodily function is where we capture those chronic medical conditions. For instance, with diabetes, the operation of the student's pancreas is substantially limited. You also see we have things like performing manual tasks, reading, sleeping, speaking, standing, thinking, walking, working. So as you'll see here, this list is it's pretty much all encompassing of anything that a student would need to do throughout the school day, talking about physical access to the school building as well as the ability to access the curriculum. So if a student meets these three criteria, if they have a physical or mental impairment, and if the team determines that it substantially limits at least one of those major life activities, the team proceeds and writes the 504 plan. What you're seeing in front of you are the things that go into this plan. So at the bottom of the pyramid, the real meat of the plan is the instructional and classroom accommodations. These are what the student is receiving every day in the classroom where they're spending the most of their time. So we're talking about things like chunking of assignments, redirection if the student's off task, preferential seating. Moving up, students might also receive behavior management plans if they're on a behavior management system that is different than the normal behavior management system. They can also receive related services such as audiology, speech language pathology, occupational therapy, physical therapy, or behavior support services. They may also receive some assistive technology. And then finally, at the top of the pyramid, we have standardized testing accommodations. These get a lot of attention because we're talking about our high stakes testing such as PARCC. Those can certainly be written into a 504 plan. We just put them at the top of the pyramid because what we're most concerned about is at the bottom of the pyramid that the student is receiving the instruction when they're in the classroom. So considering all these different types of accommodations and services that a student could receive, what we do is we look at the areas of concern for the student and then make accommodations for these areas. So we look at the different types of classroom instruction, recognizing that a student might need different accommodations for when they're working independently versus when they're working in groups, versus when they're presenting material orally, or when they're doing homework. We also consider special classes, especially for our students with physical disabilities. They might need some accommodations around PE class. Noting that 504 is not just for the academic parts of the day, it's also for those non-academic periods. So is the cafeteria accessible for the student? Is recess accessible? Can they take part in birthday and holiday parties, which is a big concern for our students that might have some food allergies? And also making sure that field trips are always accessible to all of our students. And then the last piece here is the physical access to the building. You know, are our buildings actually accessible for our students? If there's a student with a mobility impairment, is there maybe a ramp for them to get in the school building? Can they access all their classrooms? And then can they also access the special area classes like PE, library? Do they have access to the media center if they need a computer? So big picture, what this process looks like is the school receives a referral. Normally this comes from the parent. It could also come from a teacher or someone else that knows the student well. Once they receive the referral, in DCPS, we have a 15-day timeline for them to hold an eligibility determination meeting. At this meeting is where the 504 team walks through those three criteria that we talked about. does the student have a physical or mental impairment, and is it substantially limiting at least one of their major life activities? If the team determines yes, the student is eligible, and then the team moves forward and writes the plan with those accommodations. After the plan is developed, we then have some monitoring. Every year, the team comes back to the table and reviews the 504 plan, and every 3 years, the team comes back to the table and reviews the 504 eligibility determination to make sure that the student is still meeting the criteria of an individual with a disability under Section 504. So you'll notice I referred to the 504 team. This is made up of individuals from the school, and at least one person from each of these 3 categories of individuals must be present. So there must be at least one person that's knowledgeable about the student. We like for this to be the parent and guardian. We strongly recommend that whenever possible. The next person is the individual knowledgeable about the evaluation data. This person varies a bit based on what the student's disability is, but if it's a chronic medical condition, it's normally the school nurse. If it is a mental health impairment, it might be the school psychologist or the school social worker. And then finally, we have an individual knowledgeable about the accommodations and the placement. This is pretty much anyone from the school building can fulfill this. It's someone who is familiar with what the school setting looks like throughout the day. So a teacher and administrator is normally who fulfills that role. So just to recap a bit of the differences between IDEA, which is special education, and Section 504. So IDEA is a federal statute. It's a federal education law to make sure that all children to make sure the children with specific disabilities have access to a free, appropriate public education. On the other hand, Section 504 is a much broader civil rights law, which protects the rights of all individuals with disabilities. Under IDEA, we're only serving eligible students who are between the ages of 3 and 21, whereas 504, there is not an age limit on, you do not age out in Section 504. And then finally for IDEA, that's where we get the IEP, the individualized education program. And then for 504, we're giving students some accommodations so that they can access the existing general education curricula. So now Deanna is going to walk us through a little bit about how Medicaid plays into all of this.
Great, thanks, Caitlin. So I wanted to, some folks on the call or on the webinar probably have heard of the free care rule, and maybe a smaller chunk have heard of the Centers for Medicare and Medicaid's rescission of the free care rule that happened a couple of years ago. And basically, instead of going into all the details of the free care rule, what the rescission of the free care rule means is that schools now have an opportunity to become a Medicaid provider, which means that they are able to bill for the services that they're providing in the school. Now, already schools are Medicaid providers because currently most, if not all, school districts across the country and charter schools across the country are able to bill for services provided on IEPs. And remember what Caitlin talked about, that IEPs are those special education services. So behavior supports, occupational therapy, physical therapy, audiology, speech and language pathology. Those clinical services that are on a student's IEP, school districts across the country tend to be billing Medicaid for those services. What we were not allowed to do before was bill for those exact same services beyond really special education services. And so the feds removed that requirement, that limitation, and now school districts are allowed to bill Medicaid if they're allowed to within their state. And that's a bit of a caveat that gets confusing because states have Medicaid state plans. And so if your Medicaid state plan limits who you can, what services you can bill Medicaid for, which most state plans do, then you still have to follow your state plan. if your state Medicaid office decides to go ahead and let the school districts bill Medicaid for other services, then they likely would have to engage in a process to amend the state plan to allow the school to be a Medicaid provider for services that are really IEP lookalike services, but are being provided to students within the general education population, and specifically 504 plans. And so you may have seen some this news hit your inbox through School-Based Health Alliance or any other associations that you belong to, that now students with 504 plans, there's a potential for schools to be able to bill Medicaid for those services too. And so why do we want to bring this to you? At least in DC, our school-based health centers are billing Medicaid for the services that they are providing to our students. You know, they hang a shingle in our schools. They operate independently. They are not part of the school. They are within the school, but they are not part of the school. So they're not our employees. They are on contract by our health department to provide school-based health center services in our schools. They're existing community providers that have come into our schools. So they use their existing relationship with Medicaid to continue to bill for the services that they're providing to our students in our schools. What's different about, you know, what I was just talking about is that so school-based staff are schools. They are the school providers. So our clinical social workers and our physical therapists and our audiologists are school employees providing services under the school umbrella, and the school is the provider. And so DC has gone through a process over the past year or two since the rescission of the free care rule to really sort of discern whether or not it would make sense for DC to amend our state Medicaid plans so that our schools could then bill Medicaid for these clinical services that are provided to students through their 504 plan. We are still in the process of assessing that, and some of you may be aware of the Healthy Students Promising Futures Learning Collaborative. If you aren't, it's a national learning collaborative convened by the Healthy Schools campaign and the Trust for America's Health to sort of bring the education and Medicaid partners within states together to, you know, push us basically to the drawing board to figure out whether it makes sense for us to amend our state plans. And, you know, we work very closely, as if you've ever been to DC, you know that it's a city. So while we have state functions, our state Medicaid office is 2 metro stops away from us. So it's very easy for us to get together and run these numbers. We have the internet, we have email, we also are 2 metro stops away from each other. In other states, the state education agency and the state Medicaid office may be further away from each other or may have a harder time to get to each other. So this National Learning Collaborative is bringing us together so that we can sort of engage in conversations together. So, you know, there's more to tell on that, but I would encourage you to learn more about what your state is doing to figure out whether they will be able to bill Medicaid for these clinical services that are provided under a 504 plan. It has the potential of bringing in a lot more federal resources to support services that are already being provided, and it was an initiative to sort of bring the school health services in line with the vision and the priorities under the Affordable Care Act to really incentivize early intervention and prevention. So it's an exciting opportunity if the numbers work out. It really depends on how your schools are billing Medicaid, and so there's more to come on that. Here are some of the additional resources that we have gathered along the way that can be helpful to you as you sort of wrap your head around what 504 plan services are and how your school-based health center can link arms with your educational partners in the building to figure out how to write better, more effective 504 plans for the students that you share in the building. At this point, I think that we would like to stop and take some questions.
We do have some questions from the audience. The first question is, the outside providers are allowed to take students out of instruction to provide them with non-academic services, right?
I'm not quite sure what the question is. If the question is, I'll answer two questions. I'll answer first, there's a question, I think the question is, can the school-based health center staff take students out of class to provide them with health services? And that really depends on your school. We would discourage students from missing class unless it is a service that they can't receive before school, during lunch, during study hall, or after school. So we would really try to encourage the school-based health center to work with the school staff and the student schedule to bring the student into the health center at a time when it wouldn't disrupt one of their classes. I'll answer a second question, which is, do we pull students out of the class for 504 services or IEP services? And the answer is yes. That sometimes happens because it's part of their learning and it's part of the intervention that is supposed to either enable them to access the modified curriculum or enable them to access the general education curriculum. So sometimes they are pulled out of class. Sometimes the services don't require a student to leave class. For example, we had a student who had an allergy to fish oil, but all we needed to do was make sure that he didn't enter the cafeteria while fish was being prepared. So he didn't have to leave class for that accommodation on his 504 plan. We just needed to make sure that he was able, that he did not go into the cafeteria. Say another student just needs frequent access to water. That would be another example of an accommodation that would be in a plan that, depending on how the student and the teacher work that out, either the student has a pitcher of water in the classroom or the student is allowed to leave the instruction momentarily to grab water.
So Deanna and Caitlin, I see that we still have a lot of questions that people are typing in our Q&A inbox. So while we want to give everyone an opportunity to answer the questions, we do have a few announcements that we want to touch on before we get back to questions.
Great, go ahead.
So while you answer your questions, let me tell you a bit about our membership. The School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based healthcare. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after the presentation to join our website using the link on your screen for more information and to join. We would also like to announce our back to school reminders. Let's talk data. You can now complete your national school-based healthcare census and report the national SBHC performance measures through our census portal. Please take time to get more information on our website and enter your data today. Also, beginning Monday, September 18th, you can submit your abstract for our 2018 National School-Based Healthcare Convention. Our 2018 convention will take place on June 24th through the 27th in Indianapolis, Indiana. Please save the date and we look forward to seeing you there. Now, we definitely want to ask our presenters a few questions, so we're going to go back to our Q&A box. So we have a question that says, I thought you had stated the difference between an IEP and a 504 plan is that with an IEP curriculum is modified and that with an 504 curriculum is not modified. However, one of the slides for 504 plan stated that an accommodation may be altered classroom materials. Can you clarify how this is different?
Yeah, so we might alter the material, but we're not changing the actual curriculum. So by what curriculum, we mean the essence of what we expect students to learn and the standards by which we are judging that learning. So for example, in a math class, say an assignment is that a student needs to do 30 multiplication tables. If the point of that assignment is that the student can prove they can do 30 multiplication tables, then we're not going to change that. The student with the 504 plan still needs to do those 30 multiplication tables. If the point of that curriculum and the standard is just for the student to prove that they know how to do multiplication, then in that case, we might change the material a little and say, okay, this student only needs to do 20 of those multiplication tables. So what matters is the gist of like what is the expectation and that we are holding students to, and what is the standard and what is the core of what the curriculum is getting at. That we're not going to change for a student with a 504 plan, whereas for a student with an IEP, we might modify that.
Our next question we have is, how do you write a 504 plan?
Right, so to write the 504 plan, the 504 team comes together, which is those three categories of individuals. So someone knowledgeable about the student, someone knowledgeable about the evaluation data, and someone knowledgeable about the accommodations and the curriculum. And as a team, they decide what accommodations and related services the student needs to access the general education curriculum. And then they sit down and they write that. That's going to look a little different, like what the actual plan looks like is going to look different from school district to school district, but that is the general process that takes place.
And so that's an opportunity for the school nurse or the school-based health center staff member who's treating the student to be invited to the table and provide their expertise. Oftentimes the school nurse will help interpret any medical orders that come in from a treating physician outside of the school. And then it's also an opportunity for the school-based health center staff to be there to help sort of clarify what medical orders they would be submitting.
So we have a question. Can you repeat the name of the organization that you mentioned? It started with Healthy Services.
Maybe this is the Healthy Students, the Learning Collaborative regarding Medicaid. Yeah, it's two organizations that the Trust for America's Health and the Healthy Schools campaign. They are convening this group of state Medicaid directors and education partners within the state to determine whether they would want to revise their state Medicaid plans to allow for schools to bill Medicaid for clinical services that are provided to the general education population, such as services in a 504 plan.
Does the law require that a 504 meeting take place?
So the law is a bit vague, honestly. The OCR, the Office of Civil Rights Guidance, is where these like who needs to be at the meeting and that the meeting needs to take place. The timelines are also not exactly actually written in the law. However, those timelines that we use for when the meetings have to take place are pretty standard in that it's not in the law, but that's the best guidance that most school districts follow. The 1 year of coming back to have a meeting to review the plan, and the 3 years coming back to have a meeting to review the eligibility. But no, the law is not nearly as specific as the law around special ed of like exactly when meetings need to occur.
Does a student need to requalify for an IEP after any length of time?
Yes, IEP actually has the same timelines that we in DCPS use for 504 or are used for students with IEPs. They review their eligibility every 3 years.
If your state does not include 504 services in their plan, is it risky to ask for an SPA, given the review may generate additional compliance requirements?
Well, yeah. Well, right. There's more work if you're billing. That's a great question, and something that should be decided at your state, at the state level. You know, whether you have the capacity to take that on, if your school district already has a Medicaid team that's billing for billing Medicaid for IEP services, and it's the same set of clinicians that are going to be providing those same sets of services, but to the general education population, and your Medicaid team has the capacity to take on the additional billing, it might make sense for you. But yes, right, to make money, you have to spend money. That's an important consideration for to be included as your state decides whether or not to change the spot.
So we also have some questions in our chat box, so we want to get to those as well. So how willing have your SBHCs been to being involved in the 504 process with school staff? Also, what services are your school-based health centers, excuse me, currently capable of providing for that could be utilized with students needing or possessing a 504 plan?
That's a great question. In my experience, the limitation hasn't necessarily been on the part of the school-based health center staff. Our school-based health centers in DC have excellent staff who are very willing and interested in collaborating with us. It is mostly, you know, our responsibility as a school district to encourage our school staff to remember to invite the health staff in the building to those 504 meetings. You know, they'll gather the key people in the room and invite the parent, invite the student, whoever else, and then maybe forget that they have these health experts in the building who probably could contribute a lot to the meeting. So it's, you know, it's just, you know, us doing our part of continuing to encourage our school staff members to make sure they're not leaving anyone out of the conversation who could really help improve the conversation. And sometimes, you know, we have medical orders come in for services, and those medical orders get discussed in a 504 plan, and it's an excellent opportunity for a school nurse or a school-based health center staff member to really help interpret what is supposed to be going on and what's also in the best interest of the student. You know, maybe sometimes exactly the way it's written is hard to implement at the school level, but maybe you say, well, why don't we do it a little bit like this? And then bingo, everything falls into place with the school schedule and the students' desires and things like that. There's a second part of the question.
Could you repeat the second part?
Yes, so also what services are your school-based health centers currently capable of providing for that could be utilized with students needing or possessing a 504 plan?
Right. So typically, I don't think it's so much as the school-based health center helping to provide the 504 plan services that the schools would normally be providing. You know, it's our, you know, we have the legal requirement. We tend to want to be the ones doing the work. If the student needs an audiologist during the school day, we would use our audiologist. But if there are lots of medical interventions, so if the student needs to get to the health center several times a day or once a day or something, we want to make sure that that's written into the plan and that the health center says, yes, we want that student sent over to us every single day at this time. And so that's, you know, those are we would want the health center to continue to provide the health center services, but there might be health center services that that are important to include in a 504 plan. You know, as Caitlin was describing, so the 504 accommodations fall way beyond just the clinical staff that work for the school. From, you know, a table where nobody's eating peanuts to, you know, a kid being able to carry their insulin with them. You know, there are all sorts of accommodations that that a school-based health center staff, the treating physician or treating nurse practitioner at the health center would be able to influence in the writing of that 504 plan.
Okay. How do the school-based health centers determine Medicaid eligibility?
I think that depends on the school-based health center. Usually, you know, in DC, our families submit enrollment packets that have a lot of that information on it. So the parents would enroll the student in the school-based health center, provide all the necessary information in that enrollment packet, and then the health center takes it from there. I'm not sure beyond that, sort of how they, you know, the nuts and bolts of that.
How do you suggest schools handle schools or students enrolling in schools with special medical needs, such as tube feeding, trach suctioning, and they don't come to school prepared with physician orders?
Do you want to take this? Why don't you start?
Okay, so we actually cannot do any of that if we don't have physician orders. So one of the strategies that we use if maybe it's hard to get the parent to bring in the medical documentation is we'll ask the parent to sign consent for us to talk directly with the doctor, and then we can get the physician's order that way, but we can't actually do any of those services if we don't have the medical orders.
Right. Right, and so we have, you know, our students come to us in a variety of ways. Perhaps they need a 504 plan, perhaps they're homebound and need homebound instruction, or perhaps they come through this, they give information to the school nurse. For all of those things, what Caitlin said, you know, we've got to have that documentation in place. A lot of our families that have challenges in getting the paperwork to us will allow us to talk to their physician directly. And for example, the school nurse program that the health department runs for DCPS, they have case managers that will do some of that firefighting on behalf of the family to help get the paperwork into the school.
All right, so we have a lot of questions, so we're going to do 2 final ones, and then we're going to have to end the webinar. So I have a question. Is the 1-year review and 3-year eligibility review standard for all states?
So it's not standard in that it is technically in the law, but it is the best practice that, to the best of my knowledge, most school districts have adopted because it does align with the timelines of special education. The law says that you need to review the plan and the eligibility at some point. It is unclear on what they think of as timely in the federal government, but the best practice is to align it with the special ed timelines of the 1 year and the 3 years.
Okay, our last question. We are an NYC community learning school and make partnerships with the community in order to provide health services for our students. Do you have any suggestions of organizations we can partner up with if we do not have a school-based health site?
I'm not familiar with the New York City specific organizations, but I would definitely encourage you to have a conversation with the staff at the School-Based Health Alliance. I suspect they can help, you know, brainstorm with you on organizations that can help support you.
Thank you very much.
I'm also happy to talk offline around some of the provider outreach that you've done. You know, most of our kids have health insurance, so for us, our priority has been to recruit providers, community providers that are willing and able to bill Medicaid.
Thank you all for putting in your questions. We will be sending these questions to our presenters today, and they will try to get back to you as soon as they can.
Now to our attendees, we have a few questions for you. Did this presentation meet your needs? Yes or no? How well did the presentation meet the stated objectives? How likely are you to apply information from the presentation in your organization? And would you recommend this webinar to others? So we're just going to give everyone a few minutes to finish up with our evaluation poll questions. Thank you for attending our webinar today, and our sincerest thank you to all of our presenters. If you have any additional questions, feel free to contact us at the email listed on the screen.